Good afternoon and welcome to today's webinar with the Arkansas Department of Human Services. This webinar is brought to you by AFMC. Today's webinar is intended for consumers and families and will be providing an update on TEFRA. Before we get started, I would like to go over a few logistics. To eliminate background noise, phone lines are being muted during today's event. Questions may be submitted through the online Q&A system section located to the right of your screen, and we will answer these questions at the end of the session. Today's event will be recorded and posted to the Arkansas Department of Human Services website. The panel members for this webinar are Lisa T., DHS DCO Program Manager with the Medicaid Eligibility Unit, Tiffany Cooper, DHS DCO Program Eligibility Analyst with the Medicaid Eligibility Unit, Elise Piggy, TEFRA Premium Unit Analyst with the DXC Premium Unit, Royce Pinkard, Interim Financial Manager with the DXC Premium Unit, Lori Rose, RN, Office of Long-Term Care Medical Needs, Division of Provider Services and Quality Assurance, Iris Gocher, DHS Division of Developmental Disabilities, Letha Bell, DHS DMS TEFRA Consumer Advocate, and Lainey Morrow, presenter with DHS Communications. We will now turn the presentation over to Lainey Morrow.
Hey everybody, thanks for joining us today. We appreciate that you're taking your lunch break to join us and talk about TEFRA. We have a lot of great information, some updates and process changes, and then resources to give you. And we're going to answer your questions. And you just heard about our fabulous panel we have with us today. So I'm not going to go through the whole thing. We'll get to hear from them as we go through our presentation. We do have some key terms that we want to go over before we get started, just so that if we say an acronym maybe you don't recognize, you can get caught up before we get there. So DDS stands for Developmental Disabilities Services. DMS stands for Division of Medical Services. DCO stands for Division of County Offices. And these are all divisions of the Department of Human Services. When we say beneficiary, we mean a person who receives Medicaid. When we say provider, we mean anyone who's licensed in Arkansas as a Medicaid provider who serves clients and beneficiaries basic medical or specialty service needs. And so this could be a doctor or nurse, a hospital or clinic, therapists, counselors, pharmacists. Then there's EIDT, which means Early Intervention Day Treatment. TEFRA, which we're talking about today, stands for the Tax Equity and Fiscal Responsibility Act of 1982. And then EPSDT, Early and Periodic Screening, Diagnostic and Treatment Services. So we just wanted to make sure, in case we go over any of those or anyone's title has an acronym you don't know, that's what that means. So let's dive into what TEFRA is. We may have some people here who are new to TEFRA or some people who are interested in TEFRA. So as I said a minute ago, TEFRA stands for the Tax Equity and Fiscal Responsibility Act of 1982, and it's a Medicaid program that can help families with children 18 years of age and younger who have a disability to receive care in their homes rather than in an institution. And the TEFRA program can help pay for the cost of those services for eligible children. Some families won't have to pay anything as a part of the program, while others will pay a premium on a sliding scale depending on their income, and we will go over that later. Children who live in an institution or receive extended care in an institution are not eligible for TEFRA, and all Medicaid state plan services are available through TEFRA, and right there we just gave you some highlights of the services. That's not all of the state plan services, but there's some ones we use a lot. So speech therapy or physician specialists or going to the pharmacy, those are all things TEFRA covers. Services paid by Medicaid. So TEFRA is just one of many programs paid for by Medicaid. And So, for example, our kids A and TEFRA pay for the same services. Children 18 years of age and younger can be enrolled in these, and they're eligible to receive the same list of services. Medicaid pays for our kids A and TEFRA, but a child qualifies based on meeting a financial eligibility and medical evaluation for TEFRA. So that's the difference. You don't necessarily get to choose which program you're on. It's based on how you become eligible. So there are 3 requirements that must be met. The child must have a disability that meets the definition of Social Security, must meet a medical necessity and appropriateness of care, and there's a financial requirement. But let's circle back around and just address that children 18 years of age and younger, because I know that we probably already have questions about that. So let's talk about that really quick.
This is Lisa. Just to clarify, the TEFRA program covers children up till their 19th birthday. At that time, their TEFRA case is going to close, and they will need to apply for services in another program, such as Arkansas Works, or if they have Medicare, they can apply for one of our Medicare savings programs to help pay that Medicare premium.
Okay, great. So let's talk about eligibility. Children must be 18 years of age or younger and must meet the Social Security Administration's definition of disabled. If the child has received supplemental security income within 1 year prior to applying for TEFRA and continues to have the disability but lost the SSI benefits because of an increase in his or her parent's income, then a child may still qualify for TEFRA. If SSA has not established a disability, then a medical review team will review your child's medical records to establish whether your child has a disability. In the application packet for TEFRA, there's a form that asks you to identify your child's physician and other providers and give the Arkansas Department of Human Services authority to request your child's medical records. DHS has doctors on staff who review these medical records provided by your physician to make the disability determination. The child must have a medical condition that would require institutional placement, in a hospital, a skilled nursing facility, in an intermediate care facility for individuals with intellectual disabilities, an alternative home placement, or be at risk for future institutional placement. Medical necessity is also based on services that improve or maintain a child's health or prevent a child's health from getting worse. The medical review team will also determine what appropriate medical services need to be provided and if those would be available to your child in the home. The estimated cost of the care cannot exceed the estimated cost of care for a child in an institution. The child cannot have personal income that exceeds the long-term care Medicaid limit, which is 3 times the SSI income limit and can change each year. The child cannot have countable resources that exceed $2,000. Countable resources for a child can include cash on hand, bank accounts, vehicles, etc. Parental income and resources are not considered. Only the child's income and resources are counted. Can we just cover consent forms and things we need to make sure that get sent in when they're trying to be eligible for TEFRA?
Yes, this is Lisa. It's just really important that they complete those 4,000 consent for release of information and complete all forms in the packet in their entirety and give us as much provider information as possible. This really speeds up the process for our medical review team and our Office of Long-Term Care to contact the providers and get the information that they need to make those eligibility determinations.
Thanks. Good to know. Okay, so the TEFRA premium. TEFRA is a cost-sharing Medicaid program. Families whose annual incomes after allowed deductions exceed 150% of the federal poverty level will pay a monthly premium to participate in the TEFRA program. The premium amount is based on a sliding scale by income. Those families whose incomes are below 150% federal poverty level will not have a premium. The premium payments begin the first month after your application has been approved, and the total out-of-pocket cost sharing or your premium cannot be more than 5% of your family's gross or before taxes annual income. How are premiums determined? Well, take a look at that chart there. Monthly premiums are based on a family's household size, the number of people living in the household, and the annual income as reported to the IRS. Families can deduct $600 for each dependent child living in the home, along with excess medical and dental expenses, as shown on Schedule A of the parent's federal tax returns. So Chart 1 shows the 150% federal poverty level income amount for different household sizes. Then here on Chart 2, if your income is more than the amount for your household size shown in Chart 1, then your premium is based on a sliding scale shown here in Chart 2. We'll give you a look at that for just a second before we move on. How are premiums collected? After your application is approved, you will receive a welcome packet from TEFRA that includes a payment selection form. You can choose your payment option to be a monthly automatic draft, or you can pay using quarterly advance payments by check or money order. Credit card payments are not available at this time. So let's just stop on this one and talk some more about it.
This is Tiffany Cooper. Prior to the welcome packet, TEFRA workers just go through the process before you receive the welcome packet. TEFRA workers at your local DHS county office will set up your premium or guardian account to begin the first month following the month of application when the application is approved. Once that TEFRA premium has been keyed again based on your household size and annual income as reported to IRS, a welcome packet is then system generated and will be sent to you, the guardian or parent, regarding your premium payment. And you'll learn more about the welcome packet later in the presentation.
Okay.
And this is Elise Biggie with the TEFRA Premium Unit. Regarding the welcome packet, it consists of a premium notification letter. It lets you know what your TEFRA ID number is. It includes a payment selection form as well and a prepaid business reply envelope. It's important that you return these items upon receipt. When you do, if you ensure that you are sending in both the payment and the payment selection form, that helps us a lot. Sometimes we receive payments and not the form, or forms and not the payment, and we need them both together. If you opt for the monthly option, your account is drafted at the first business day of each month, and you receive invoices monthly. If you opt for the quarterly payment frequency, then it's an invoice every quarter. We no longer send them monthly if you're a quarterly frequency payer. And you would pay in advance every 3 months, either check or money order.
Thanks. So they just kind of cover this, but we'll go over these next 2 points. Regardless of the option you choose, you will need to pay the first 2 months of premiums in advance by check or money order. If you choose the bank draft option, the premium will automatically be withdrawn from your bank account after the first 2 months premium has been prepaid. If you choose the advance payment option, you will receive monthly invoices in the mail. If you fail to provide the payment selection form, which was what she was just talking about, it's very important, which is provided in your TEFRA welcome packet, or if you fail to pay the 2-month initial premium payment, that could cause your child to be ineligible. So thank you for those tips. What if premiums are not paid, which we hope would not happen ever, right? If the premium is not paid for 3 months while your child receives TEFRA, the coverage will end. If that happens, you will have to fill out a new application to determine if your child is eligible for TEFRA. If your child's TEFRA coverage has ended within the past 12 months because premiums weren't paid, those premiums must be paid in full before the child can be reapproved for TEFRA waiver services. Okay, so let's move on. We appreciate y'all sending your questions in, and please do so because we will get to them later. Let's move on to applying for TEFRA. So you can apply for the program by filling out the TEFRA application packet and submitting it to your local DHS county office. All offices are on our DHS website, but most of you probably know where your office is. If you have any questions, make sure you let us know if you don't know where your local county office is. Download an application and all necessary forms at that web address there on our website. It'll save your trip to the county office if you don't want to, if you just would like to download them ahead of time and make sure you have them all filled out before you go to your county office. That's also an option. DHS has 45 days to determine eligibility, which we just talked about, on the TEFRA application, if a disability determination is not required. Disability determination would not be required if your child's disability has already been established by the Social Security Administration. If SSA has not established a disability, then a medical review team, which includes doctors on staff at DHS, they'll review your child's medical records to establish whether your child has a disability. Staff have up to 90 days to determine eligibility for TEFRA if your child's disability must be determined. In both cases, once your application has been processed, you will be sent a letter to let you know whether your child's application was approved or whether your child was determined to be ineligible for TEFRA. And we just wanted to show you what the website looks like. We have the list of all the forms that you can download there. Do we have any tips on some of these forms?
Yeah, this is Lori with MedNeeds. So I do the medical review side of it. It's very beneficial and speeds things up if you make sure as a parent you fill everything out you're supposed to fill out. Fill it out completely.
Thanks for that tip. That's great. And I really appreciate these are online to be able to fill them out. Makes it easy for me to get to them. So I'm happy they're all right there at our fingertips. Now we want to talk to you all about some improvements that have been made in the process. So to applications, there have been some improvements. The application and forms have been simplified. Repetitive questions were decreased and some forms were combined. Renewal packets are being sent earlier and more time is being provided to complete them. That's really great news. I love to hear that. For premiums, the layout of the premium invoice was updated and important phone numbers were added. Improvements that involve staff, TEFRA roles, and responsibilities of DHS staff have been clarified and communicated to all divisions. And training has been provided to all staff. And then with resources, new resources available, we've kind of gone over some, the application and renewal form are now available on the DHS website. So you probably just saw them on there. And the TEFRA website has been updated and new resources have been added to help beneficiaries. And after we get finished with this webinar, we'll post it on there. So if you have any friends who are interested in learning about this, make sure you send them to the TEFRA website, humanservices.arkansas.gov/aboutDHS/DMS/TEFRA. It's at the bottom of your screen there. So let's just talk about this. This is one of the invoices, right, that people will get. Let's talk more about it and walk through it.
This is Elise again, the premium unit. The invoice design itself changed and the way the data is structured on there. The top right side, of course, is the invoice date. That's the date and usually the month that applies to whatever the premium is if you're monthly, or the premiums are for 3 consecutive months if you're quarterly. The document number is internal. The TEFRA account number is your child or children's TEFRA account ID number. This page that we're looking at now is the bank draft change form, and from the old design, there were no options besides just writing in your information for the bank account. Now there are three. The first box is if you're wanting to set up a new bank draft altogether, brand new. The second is if you already have one established and you're wanting to revise it. Let's say your bank account number changes, the ABA routing number is the same, a change is the second box. The third box is if you're wanting to cancel it altogether, your bank draft. There's a disclaimer, the bank account holder signs and dates and then mails it. It's pretty self-explanatory for this part. The second part of the invoice is the actual information regarding the premium and balance and previous balance or credit that apply. Looking at the table on the left, it just depicts a quarterly payment frequency payer. The first row indicates March of this year. The second is April of this year. May of this year is third. And each row, the premium amount is the monthly premium amount associated with the actual benefit month to the left. So, for instance, this person in March of this year, their monthly premium is scheduled to be $51.64. And the same for April and May as well. Some months, some quarters, a person's monthly premium will change, and that's reflected on this table in the rows for whichever month it applies to. So, for instance, if it changed for whatever month, it would show it in that table. The premium balance on the right, previous balance on the right is if there is a previous balance or previous credit would be indicated as well with parentheses. The premiums today amount is adding up those three amounts on the left in the table. That's the total for the premiums today. You would add those two together, or you subtract whatever's applicable for, if it has parentheses and it's a credit, and you would come up with either the credit or balance that's shown in the long rectangle at the bottom where it lists credit or balance. The rest is pretty self-explanatory, just asking you to mail in your check or money order, how to send it, and where to send it.
Okay. Can we go back to the first page? I have a question.
Okay.
What if I wanted to not do anything? So I get this as a renewal or, for my premium. What if I want my draft to stay the same?
I'm glad you asked. We get that question a lot. You just leave it all blank.
Okay.
You don't have to fill out anything. This form here comes with each and every invoice, every time, monthly or quarterly, and it's there if someone needs to make an update. If you don't, just like our old design, you would just leave it completely blank.
Okay, perfect. So you were moving on to the third one. Sorry, I interrupted.
And that third one is just basically a table. It used to come in a table with our old design. Now it lists, and this one doesn't have a whole lot of lines. Sometimes there are a lot of rows for them. It lists what your amount was, a carryover amount if you had one, or a credit, and what your new amount would be. The important reminder section just gives you some information regarding what to use when you're sending in your payments, and make sure you include the TEFRA account number, and that's very important. If you get a payment, we don't have a TEFRA account ID number on it, or a predicate number, and the name is not in our system, we have no way of finding out who the payment is to be applied to. Okay. So that's very important. The top portion of the statement comes back with the payment. We cannot accept cash, we cannot accept phone payments, credit card payments, online payments, unfortunately, at this time. They're just asking that you don't send anything in addition to the invoice and payment, just the invoice and payment as they're requesting. Don't fold, staple, glue, or anything that you ordinarily wouldn't do when you're sending in a payment. 6 and 7 kind of speaks to the draft portion. If you're setting up the draft, it requires that you send in everything requested in a timely manner. It's asking that your balance not be greater than 0 when the drafts start. They start where you're at as far as your balance, and the balance needs to be 0 because once you start drafting, it does not go back and pick up any previous balances. So it's kind of just speaking along the lines of what to do if you want to set up drafts, revise drafts, and what to do to get your payment in and post it.
Great. Thank you.
Mm-hmm.
Appreciate that. So then there are resources around the state. We have area staff, and these are their names and numbers and where they serve in the state, this map here, to help you know, depending on where you live, you have a person who can help you for your area. Does anyone want to add to this? What are the green? What's the green mean?
That's where they're housed. The TEFRA units are housed.
So green is where the TEFRA units are housed. All right, make sure you keep that handy. And then we wanted to clarify just if you're going to send a TEFRA application, make sure you send it to your local DHS office. If you're sending a TEFRA payment, you send it to the TEFRA premium unit at that address. And then also there's a TEFRA premium unit call center, and that's their number and their weekday hours that we wanted to let y'all know about if you have any questions.
And this is Lisa. I just wanted to clarify also that if you have a household change that needs to be reported, such as a change of address or change in household composition, that those changes should be reported to your local DHS office.
Perfect. Okay, so we have now reached the time in our presentation when we're ready to answer your questions. I think we have some that already have been asked. We're at the Q&A now. Do we have any questions we want to answer? Okay. Okay. So, let me see. So, we've got some we've already answered, actually, because you guys are great sending in our questions. If you are denied for SSI and appeal that decision, but in the process of that, apply for TEFRA and are denied, do you have to wait 1 whole year before reapplying for TEFRA? Can you please provide the reason behind this? So, our answer was, you may apply for TEFRA at any time. A disability determination will be made at the time of application. So, let's see here. We've got another one. Let's see. If household income changes from the time of applying, is there a way to update this to see if premiums change? So our answer to that was income and household size changes are to be reported to DCO, which stands for the Division of County Operations, or your local office. They take it from there. Premiums can be adjusted once every 6 months. So then someone sends a question that said, will coverage be retroactive to 90 days prior to application date? The TEFRA application can be retroactive 3 months prior to the application date, not to begin prior to the onset of a disability. Okay? So this question says, have TEFRA, no SSI. Application for SSI pending or appeal. Regina, you threw me for a loop here. Will be 19.
On August 2019.
There we go. What happens if final SSI decision still has not been made yet? On Medicaid waiver list is Tier 3.
And then we can ask the panel that can answer that question for Regina.
I need to research that.
Okay, we're going to research that one, Regina. We'll get back to you on it. Tori asks, are the disability requirements different for SSI and TEFRA? No, they're not. That was easy. Thanks. We like those questions. So no, they aren't different. What does TEFRA stand for? That was early in the presentation, and we probably do need a reminder, right? It stands for the Tax Equity and Fiscal Responsibility Act of 1982. Let's see. Sue asks, if income changes by more than 10%, can the TEFRA premium be updated more than once every 6 months? Panel, what do we say?
I'll give a panel a couple of seconds to research and see if they can answer this.
No. It's not even changed once every 6 months.
All right. I don't know if y'all heard that, but, so no, it can't change more than once every 6 months.
Right.
Is the answer. Have we reached the end of our questions? We're going to give y'all some time. Send us some questions. There we go. Regina asked, do you know if you can still get your private insurance premium reimbursement through RHIP after the age of 19? I don't know. Regina, we're going to have to take that one back too. Sorry, but we promise we'll get back to you. Sue asks, is there a reason premium overdues increased dramatically this month?
Can you elaborate on that? This is Royce.
So Sue, give us a little more information, but not too much information, because we don't want everybody to know your business, right? So, but just give us a little more about what you mean when you ask that question. Okay, let's see. Trish, I can't see all of Trish's question. She says, when TEFRA backdates over 90 days, is there a way to have the PCP backdated as well?
Yes, it can be backdated.
All right, that's good. So yes, it can be backdated. Okay, so Sue elaborated. We normally have 40 to 60 overdues on the monthly report. This month it jumped to over 180.
Sue, this is Royce. We're going to have to take that back and get an answer back to you.
Okay. Sue, I'm writing it down right now. We're not going to forget to write back to you and let you know. Mark sent in a question. If TEFRA participant is on the CES waiver waitlist and assigned to a PASS, how do the PASS and TEFRA work together? What services will the TEFRA child get from the PASS? And Mark, we're going to have to get back to you on that one. That one is very PASS based, and we're here to answer more about TEFRA, and so we will write you back that answer in detail. Trish, is there a process we need to follow to have the, I can't see all of your questions on the screen. It's not your fault, Trish. We're just looking here. Is there a process we need to follow to have the PCP backdated as providers? Did y'all get that question? We kind of pieced it together.
What was that question?
Is there a process we need to follow to have the PCP backdated as providers? So a process for providers.
The providers can contact the county office. And actually the parents are the ones that need to contact the
Okay,
county office
so
about backdating. Yeah.
parents need to contact county office about backdating. Regina, how should we expect your response back to us? So when you signed up, we have their email address, right? From when they signed up for this webinar. And Regina, I've got you down. We're going to research your questions, and we'll probably write you back by email, because that's what we have from your registration. Let's see. Sarah sent in a question. Child applied for TEFRA because the screen shows SSI is canceled, but another screen says SSI is open. In the meantime, the child is not getting services. So Sarah says, not sure where to go for help. Do we have any advice?
Yeah, what screen is she?
So Sarah, do you know what
Referring to-
screens these are and who did them? That might help us to answer this question for you. So if you can come back and let us know which screens, then, let's see. Deanna says, the TEFRA premium, okay. Let's see. The TEFRA premium unit will not do anything with your payment if you do not put your TEFRA number in the memo line of the check. Is that accurate?
No, it is not. You know, if it's a way to find the account in the system without the ID number, we will. If there is not, if the name's not associated, there's no valid Medicaid number that's associated with the TEFRA case, then we have no way of knowing who to apply payment to. At that time, we return it with a letter letting them know to include the TEFRA account ID number.
Okay. What are the differences in eligibility for SSI versus TEFRA?
TEFRA must mean a medical necessity. The financial limit for TEFRA is 3 times the SSI limit. And TEFRA also has to be appropriate. They have to,
care.
yeah, the child has to meet institutional level criteria.
Okay. All right. So, Tori, I hope you heard the answer to that question that you sent us. Sarah asked, the screens that the folks at the TEFRA office are checking, sorry, she doesn't have more specifics.
Okay, if she can, do we have someplace she can send an email and give us her details, and we will check on that for her?
Yes, you can send me an email and I'll make sure it gets to the right people. So my email is Lainey, Lainey, .morrow, MORROW, @dhs.arkansas.gov, and we'll respond to you, and so you can copy and paste it, because that was long. But yes, and I guess for those of you who you're expecting an answer back, you can just send me an email too. You're guaranteed an answer if you send me an email. Let's see. So yeah, sorry Sarah, we need more information specifically on which screen that you're talking about. Can you provide the TEFRA website again? Yes, I'm going to put it up on the screen actually. It's at the bottom there of that process improvements, humanservices.arkansas.gov/about-DHS/DMS/TEFRA. And I think she's going to put it in the comments for you. What does this statement mean? I'm not sure what this statement refers to. What statement do you mean, Tori? Can you send us like the quoted statement, or what exactly you mean there? Okay, so Tori sent in, what does this statement mean? Reason for action. SSI has determined that child in the, I guess it's just any child, or your child, no longer meets the SSI disability requirement in July 2018. Since it has been less than 12 months since they made this determination, and you are in the appeal process with Social Security. Is there more? Oh, that's probably the rest of it. The TEFRA application has been denied. Social Security disability determinations override DHS. If they again deny your child, you can apply for TEFRA after 12 months has elapsed. Comments?
SSA determinations are the rule. If you are declaring the same disability that SSA has just denied you for, then their judgment is going to stay. We're going to use their determination. If there's a new disability, or if you've asked for a reconsideration, then we can go ahead and process it through our medical review team.
Somebody asked, Lainey, are you working for DHS now? Yes, I am. I've been working here since August. Regina says, thank you all for taking the time to have this WebEx. She appreciates it. Thank you, Regina. We're glad you joined us, and we're glad to answer any questions we possibly can today. What other questions do y'all have for us? Tori says, thank you so much. Tori, thanks for joining us and sending us your questions. Mark asks, explain how cancellation of private insurance coverage on the child will affect TEFRA eligibility.
It does not.
I think that's a good question. I've heard that one before.
Hi, Rose.
Sarah said, as a mom of 2 kids on TEFRA and EIDT center nurse, thank you. Thanks for joining us, Sarah, and I would have to echo that. We're just kind of waiting on some questions, and if we don't get any more, we'll be done. So send us your questions. We want to give you a chance to do that. She says, RN says, how's the weather? It's 75 and sunny here. It's not 75, but it is sunny, which we appreciate after all the rain we've gotten. Well, we're winding up. If we don't see any more questions, and we haven't for a couple minutes, we really appreciate everyone who has joined us today. And tell your friends about the website that we posted earlier, because we want everyone to know about TEFRA and all the resources. We're going to post this webinar link on there, and we want them to be able to go back and watch it. So anyone who happened to miss it today, make sure you tell them about this. And we don't see any more questions. So I think that's going to be the final call for questions.
Okay, this concludes our webinar for today. I want to thank everyone for their presentation and for answering questions. As a reminder, today's event was recorded and will be posted to the Arkansas Department of Human Services website. Thank you. Have a good day.
Bye, everybody.